Hello, and welcome to our exciting new series, Katz Conversations, where you'll get to know our Katz Institute for Women's Health clinicians on a deeper and more personal level. I am Alexa Tibbin Sanfilippo, and I'm thrilled to be here today with Dr. Sarit Cohen. Welcome, Dr. Cohen.
Thank you so much, Alexa.
Of course. So the first question we wanted to ask you is, what drew you to the field of medicine that you practice?
Yes, the age-old question. So I kind of was always into science, I was like kind of that science nerd in school. But I had some family members that went through some cardiac issues when I was a young girl, like in high school, actually. And I feel like ever since then, I was just really drawn to the field of medicine, drawn to the field of cardiology specifically. And then it kind of just went off from there. I'm a first generation American and have no physicians in my family. So it was definitely kind of stepping out of what everyone else in my family was doing. But I was always drawn to the field. I always was pulled in this direction. So that's kind of what has drawn me.
That's great. So in your fields of medicine, what would you say has been the most rewarding and challenging experience so far?
Yeah, so I think the most rewarding part of medicine for me has always been taking care of the patient. I was a general medicine physician during COVID, and during those hardest times, you really have to remember what pulled you into the field in the first place and why you're doing what you're doing. And for me, it always comes back to the patient. So being able to hold your patient's hand in the hospital in their time of need, being able to help someone in that little way that you do as their doctor, that has always been the most rewarding thing. And when you're, kind of going through hell and back, like something like COVID, you always have to remember why you're doing what you're doing. And that kind of leads into what the most challenging part of the field is as well. Going through a pandemic like that was definitely the most challenging part of my career, but we kind of all pulled through it. We were all there for each other, physicians for physicians, nurses, everyone, all of us together. But I would say that that's probably been the most challenging.
Yeah, thank you for sharing.
Yeah.
So we want to get to know you a little bit more. So tell us another passion you have outside of medicine.
Yes. So I would say two of my biggest passions outside of medicine would be traveling. That's like my number one love outside of work. I love to go to new places. I love to explore different parts of the world. And I love actually doing yoga is like my newfound passion that I've had. I think it's so calming for the mind and for the body, which is definitely something that I feel like is helpful for me, especially in this profession. So it's great.
That's awesome. Any one specific place is your favorite place that you've traveled so far?
I really love traveling to Thailand. Actually, I did that during med school, actually. So quite
Wow.
a number of years ago. It's just such a beautiful country, and there's so many different landscapes to the different parts of the country that I loved it. You were like in a forest in one place, and then in another place, you're like in the city of Bangkok, and then you're in the south at the beaches. It's beautiful.
Sounds amazing. So how do you provide hope to your patients when they're afraid?
Yeah, so I feel like that's one of the most important things that we do as medical professionals. I feel that of course a lot of patients come to you and they're afraid. They don't know what's going on. I'm feeling this, I'm feeling that, they're coming for answers. And I think the thing that we can do as their providers is really just take on the stress and anxiety that they have. Like that's something I always try to portray in my appointments with my patients, that now that you've come to me, it's my job to take on that anxiety and that stress and trying to figure out what's going on, right? That's my job. You're of course, you're still going to be stressed about it. You don't know what's going on, but now I'm here to kind of take that over, and I'm going to take it from here, and I'm going to, do the testing that I need to do and figure out what's going on. And, you can kind of rest assured that I'm taking really good care of you, and that I hope that gives them hope that things will be okay. Because, that whether we find something, whatever it is that's wrong, like we're going to fix it. We're going to take care of it. And we're going to be with them every step of the way. So
That's great. So this is always one of my favorite questions that we've asked. How do you manage work-life balance?
yes, the thing that eludes everyone. It's hard. It's definitely hard. I actually just gave birth just about 13 months ago.
Congratulations.
Thank you. I have a 13-month-old beautiful baby boy. And that is, definitely something that I am focused on and think is really important for everyone in every field. For me, when I'm on in the hospital or in the office, I'm focused here. It's, 100% my focus. And then I make sure that, in all those times in between, when I'm home, when it's the weekends that are so important, I'm on as a mom, and that's my number one focus. So I think it's just, when you're taking care of your patients here, that's the focus. But then again, when it's evening time and when it's the weekends and I'm not on call in the hospital, I'm, 100% mom mode. So that's kind of the way that I go about it.
I love that. I think it's so important to be able to turn off and turn on and, different ways of living.
It's important.
Yeah, exactly. So now we're going to do some fun rapid fire questions so our listeners can get to know you a little bit more. So the first one is, what's your guilty pleasure?
Netflix.
Netflix. I love it. And now there's so many streaming stations. It's like it could be them all.
Yes.
All right. What is your favorite food?
Chocolate.
Chocolate. Awesome. What is the last great book you read that you'd maybe recommend?
Ooh, there are so many. I just recently read, let's see, I'm a avid reader. So I'm just trying to recall all the books that I read. I would say actually when Breath Becomes Air is one that I read recently that I would definitely recommend. It's about a physician actually, but it's a great book.
Awesome.
Yeah.
So so I know we kind of went one of your passions outside of medicine, but if you could quickly say your biggest hobby outside of medicine.
My biggest hobby outside of medicine, probably the same that I mentioned before. I would say the traveling is really my biggest hobby outside of medicine. I really try to get those little trips in there whenever I can. There's so much to explore in the world and not enough time. So
absolutely. So what do you hope that your legacy will be?
that is a really interesting question that I haven't thought of in a while. I think, again, I just hope that my legacy is that I was someone that my patients could really come to and could really put their hope in, put their trust in. If that's my legacy, just to, be able to take care of my patients and take really good care of them, that's really damn good. So that would really just be what I'm looking for.
Perfect.
Yeah.
What would you say your favorite movie is?
Oh, you're getting me some tough questions here. A movie I actually watched a very long time ago, very old movie, The Green Mile, is a movie I watched when I was younger that I actually will never forget. That was a great movie.
Yeah, definitely a classic. Okay, and our last rapid fire question, are you a sweet or salty person?
Sweet, 100%. I have a really bad sweet tooth. I should admit it, cardiologist, but it's the truth.
All right. Well, thank you so much, Dr. Cohen. It was really great getting to know you on a little bit more of a personal level. And we want to thank you for taking the time to join us and learn more about our Katz Institute for Women's Health Clinicians. And we hope you won't miss our next Katz conversation. So thank you again, Dr. Cohen.
Thank you so much, Alexa. Thank you.